Good morning. My name is Zach Pellis. I'm an internal medicine resident in Chicago, and I appreciate the chance to share with you my perspective on why Dr. Oz should not be confirmed to lead CMS. The role of CMS administrator hits very close to home for me as a medical resident because it would give Dr. Oz full control over the funding of all medical training programs in the country. And I don't know any of us who would feel comfortable with our paycheck and our education in the hands of our country's most successful snake oil salesman. But the problem is far broader than that. The role of CMS administrator would give Dr. Oz the chance to make good on a promise that he made when he ran for the Senate and an explicit goal outlined in Project 2025, which is the full privatization of the U.S. healthcare system. The reason this is such a risk is because Dr. Oz has been a long fan of Medicare Advantage. Dr. Oz believes that Medicare Advantage should be the sole option for insurance in our country, and the only way that's possible is with the eradication of traditional Medicare and Medicaid. This would remove coverage from millions of Americans and force them into a private option. It's already well documented that Medicare Advantage, in right now, present day, is overcharging the American taxpayer by billions of dollars per year. On the individual level, when I see a Medicare Advantage plan in a patient chart, I expect one thing: limitations. I expect there to be limits on the kind of care I can provide. I expect there to be limits on how that patient can follow up. When I've made a decision, I expect there to be prior authorizations where I have to try to justify that decision to someone who's never met this patient. This happens frequently. One example in particular I can think of was a patient I took care of in the hospital who had overcome a dramatic and life-saving abdominal surgery, but afterwards had all kinds of problems that we had to manage for her over days and weeks. This included an infection that we had to treat, an oxygen requirement we had to get her through. We put her through physical therapy. We referred her to a specialist. That specialist had referred her and recommended that she go to acute rehab. And this was denied by her Medicare Advantage private insurance company. Once they denied it, we then had to go through a prior authorization. We had to grovel and beg these people who have never met this patient to allow them to pay for the care that we think this patient needs. And often, as was the case with this patient, you go through that whole process just for them to continue to deny that care. This problem already exists. It's already a fatal flaw in our country's healthcare system, and it will only get worse under Dr. Oz's leadership. Dr. Oz and private insurance companies are one and the same, out to make a buck and uninterested in caring for our country's seniors. I appreciate your time, and I hope you'll join me in resisting any and all effort to put profits over patients.